You are just a data monkey. Press the buttons I tell you to press, and keep your mouth shut. That is exactly what Dr. Richard Sterling, a multi-millionaire oncologist, hissed at me while leaning over my desk, smelling of expensive bourbon and pure arrogance. He thought he was intimidating a low-level billing clerk into federal treason. He didn't realize he had just handed the executioner the axe. If you love seeing untouchable predators get absolutely dismantled piece by piece, hit that subscribe button right now, because this is a masterclass in financial revenge. For half a decade, I existed as the invisible ghost inside a highly prestigious private medical clinic in a very affluent suburb. The front lobby looked like a five-star hotel. We had Italian marble floors, a soothing indoor waterfall, offhand complimentary artisanal coffee in the waiting room. But behind the frosted glass doors of the administrative wing, it was a factory designed to extract every possible dollar from human misery. The doctors made the diagnoses, the nurses administered the chemotherapy, but I was the one who translated that suffering into alphanumeric codes. I was the senior medical billing specialist. My job was to take a patient's medical chart and convert it into the specific billing codes that triggered massive payouts from Medicare and private insurance companies. It is a job that requires surgical precision and absolute ethics. Change one single digit, and a legitimate claim is instantly rejected by the system. But if you intentionally swap a code for a routine procedure into a code for a complex, life-saving intervention, a $50 saline drip suddenly becomes a $500 goldmine. In the healthcare industry, this practice is quietly referred to as upcoding. In the eyes of the Federal Bureau of Investigation, it is called massive, systematic felony fraud. When Dr. Sterling took over as the head administrator and chief medical officer, the entire culture of our clinic decayed overnight. He wasn't a healer, he was a corporate shark in a custom-tailored Tom Ford suit. Before he arrived, we were a respectable oncology center, but Sterling had an obsession with revenue scaling. He drove a $200,000 imported sports car to work, constantly bragged about his exclusive country club memberships, and treated the support staff like absolute garbage. He also brought in his own office manager, a woman named Brenda. Aunt Brenda was a terrifying, overly perfumed bulldog whose sole purpose was to enforce Sterling's will and terrorize the clerical staff. If you took an extra 3 minutes on your lunch break, Brenda was standing behind your chair with a stopwatch. Together, they turned the clinic into a slaughterhouse for insurance claims. Suddenly, elderly patients coming in for basic 30-minute hydration appointments were being billed for intensive, multi-hour intravenous therapy. A quick 10-minute verbal checkup morphed into a Level 5 comprehensive emergency evaluation on paper. Code 99213 magically transformed into code 99215 on every single chart he touched. His primary targets were the most vulnerable demographics, terrified families, and elderly Medicare patients who were far too overwhelmed by a devastating cancer diagnosis to scrutinize the avalanche of confusing, multi-page financial paperwork we mailed them every month. About 8 months into his reign of terror, Sterling noticed the clinic's revenue wasn't climbing fast enough to fund his upcoming purchase of a third vacation home in Aspen. He called me into his massive corner office. It was 1 o'clock in the afternoon, and he was casually pouring himself a glass of top-shelf whiskey. Brenda was standing in the corner, arms crossed, glaring at me. Sterling didn't even ask me to sit down. He simply handed me a neon yellow sticky note. It was a handwritten cheat sheet of premium high-paying billing codes. See, he explicitly ordered me to use these specific codes for all of his patients moving forward, completely ignoring what the actual medical charts dictated. I stood there, staring at the little yellow piece of paper. I politely but firmly warned him that applying codes not supported by the physician's documentation was a direct violation of federal coding guidelines and constituted insurance fraud. He actually laughed. He took a sip of his whiskey, leaned across his massive mahogany desk, and gave me the speech. He told me that insurance companies were a cartel that underpaid brilliant minds like his. He said he was simply maximizing our therapeutic yield. He reminded me of my easily replaceable status as a high school graduate playing with numbers, compared to his Ivy League medical degree. And then, Brenda chimed in, I sweetly reminding me that the clinic provided the health insurance that was currently keeping my own mother's chronic illness treatments affordable. It was a thinly veiled threat. Comply or lose your mother's health care. He thought my silence meant submission. He thought he had successfully terrified me into becoming a willing accomplice to a federal crime. But I wasn't submitting, I was archiving. But how do you take down a millionaire doctor who has the entire hospital board of directors in his pocket? You don't just complain to HR. You don't just quit. You build a trap so mathematically perfect, he locks himself inside it. I knew that if a federal audit ever dropped from the sky, Sterling would immediately use me as a human shield. He would play the noble, overworked, brilliant physician. Chepio and Brenda would testify that the incompetent data monkey must have been making systematic clerical errors for years. I refused to spend 20 years in a federal penitentiary, so this arrogant man could upgrade the leather seats on his yacht. So I created what I called the Phantom Ledger. I went to an electronics store 2 towns over and paid cash for a military-grade, high-capacity, encrypted external drive. Every single time Sterling slapped one of his neon yellow sticky notes on my desk, demanding a fraudulent upcode, I complied. I fed the fake, inflated numbers into the clinic's main billing server exactly as instructed. But simultaneously, I routed the truth into my encrypted drive. For 2 agonizing years, I sat in my cubicle and watched him financially drain dying people. I cataloged the original, truthful medical codes based on the nurse's actual notes. Next to them, I recorded his inflated, fraudulent numbers. I logged the exact timestamps, the patient IDs, the insurance provider's billed, and the exact dollar amount of the discrepancy. But data isn't always enough to prove intent. I needed a smoking gun, so I started arriving at the office 45 minutes early every morning. Before Brenda unlocked the main doors, I used the high-resolution scanner in the records room to scan every single handwritten neon yellow sticky note Sterling ever gave me. I matched his handwritten fraud instructions to the corresponding patient files in the Phantom Ledger. I became a digital hoarder of his felonies. A few coding mistakes are a clerical error, resulting in a fine. 10,000 meticulously documented, intentional alterations, ordered by the chief medical officer and backed by his own handwriting? That is a federal RICO case waiting to detonate. The fuse was finally lit on a freezing Tuesday in late November. Mrs. Higgins was a 72-year-old retired middle school teacher. She had no family left, and she used to bring the front desk staff homemade oatmeal cookies every time she came in for her treatments. That morning, she stood at my billing window, weeping silently, her hands trembling as she clutched a medical bill for $8,400. Sterling had used her as a literal guinea pig for a highly experimental, unapproved genetic therapy sequence, just to gather clinical data for a vanity research paper he was trying to get published. He knew perfectly well that Medicare and her secondary insurance would absolutely reject the claim because it was deemed medically unnecessary. He didn't care. He simply bypassed the insurance denial and passed the catastrophic cost directly to her as an out-of-pocket expense. She sobbed, telling me through her tears that she was going to have to sell the small house she had lived in for 40 years just to pay us, because Brenda had already threatened to send the debt to a ruthless collections agency. I snapped. I left my window, marched straight past Brenda's desk, and walked into Sterling's office without knocking. I slammed Mrs. Higgins' bill on his desk and demanded he write off the predatory charge immediately. I told him it was unethical, cruel, and completely unnecessary. He didn't even look away from his dual monitors. He just sighed heavily, clearly annoyed that a peasant had interrupted his day. That was the moment he called me a data monkey. He told me to get out of his office, do my job, and make sure Mrs. Higgins was sent to collections by Friday afternoon. He wanted me to act like a machine. And machines don't have mercy. That night, I stayed at the office until 9 p.m. The building was dead silent. I didn't hack anything. I didn't delete a single file or sabotage the servers. I just compiled the final version of my Phantom Ledger. It was a masterpiece of forensic accounting. Over 400 pages of flawless, cross-referenced data. exactly $7.4 million in verifiable Medicare theft and private insurance fraud. Hundreds of high-resolution scans of his handwritten orders, organized chronologically. I drafted a meticulously polite, completely emotionless email. I attached the encrypted ledger and provided the decryption key. I didn't send it to the clinic's board of directors. I went straight to the top of the food chain. I'd see the Office of the Inspector General for the Department of Health and Human Services, the Regional Director of the Medicare Fraud Strike Force, the IRS Criminal Investigation Division, and the State Medical Licensing Board. I clicked send at exactly 2 a.m. I wiped my computer of all personal files, left my employee badge sitting neatly on my keyboard alongside my own neon yellow sticky note that just read, "I quit," and walked out into the cold night air. Sterling and Brenda didn't even realize I was a threat. When I didn't show up for work, Brenda just sent me a nasty text firing me for job abandonment. They assumed they had successfully bullied me into running away. They had no idea a Category 5 federal hurricane was already making landfall. Federal bureaucracies are usually slow, but when you hand them a perfect, prepackaged $7 million fraud case with the exact locations of the evidence, they move with terrifying speed. Exactly 1 week later, at 9 a.m., Dr. Sterling was standing in the clinic's main glass-walled conference room. He was presenting a PowerPoint on aggressive revenue scaling and Q4 projections to a room full of wealthy hospital investors and board members. Brenda was sitting at the front taking notes. The presentation was interrupted by the sound of the heavy front glass doors being aggressively held open. A dozen men and women wearing dark windbreakers with massive yellow letters on the back, FBI, OIG, and IRS, marched straight past the stunned receptionist. They didn't ask for permission. They breached the conference room in the middle of his speech. The lead agent ordered Sterling to step away from the podium and interlock his fingers behind his head. When Sterling started screaming about his lawyers and his rights, the agent simply kicked his legs apart and slapped heavy steel handcuffs on his custom-tailored wrists, right in front of his billionaire backers. Two other agents cornered Brenda at her desk, seizing her computer and phone before she could delete a single email. During the initial interrogation, which I later read about in the federal indictment unsealed to the public, Sterling played his final, predictable card. He played the victim. He blamed the billing department. He blamed the rogue data monkey, who must have been stealing money without his knowledge. The federal agents didn't argue with him. They let him dig his grave on tape. Then, the lead investigator simply smiled, reached into a manila folder, and slid a stack of high-resolution, color-printed copies of Sterling's own handwritten neon yellow sticky notes across the steel table. Checkmate. The fallout was absolute and biblical. Dr. Richard Sterling lost his medical license permanently within the month. He was slapped with 34 federal indictments, including counts of healthcare fraud, wire fraud, and tax evasion. The IRS didn't wait for the trial to end. They seized the imported sports cars, foreclosed on the Aspen mansion, and drained his offshore accounts to pay back the government. Faced with decades behind bars, he took a plea deal. He was sentenced to 12 years in federal prison, with no chance of early parole. Brenda flipped on him to save herself, but still caught 3 years for conspiracy. As for Mrs. Higgins, a few weeks after the raid, she received an official letter from the state attorney general's office. Her massive $8,000 debt was completely wiped out. Even better, she received a hefty restitution check reimbursing her for all the fake, inflated copays she had been manipulated into paying over the past 2 years. I found a new job working from home for a nonprofit healthcare advocacy group. The pay isn't as good, and the office isn't lined with Italian marble, but the air is much cleaner. I keep the newspaper clipping of Sterling's sentencing framed in a small box on my desk. It's a daily reminder that the biggest, most arrogant predators can always be brought down to their knees. All it takes is the right data, the perfect timing, and a data monkey who knows exactly which buttons to press. If you loved seeing this arrogant doctor get exactly what he deserved, drop a comment down below and tell me what you would have done in this situation. Would you have waited 2 years to build the case or blown the whistle on day one? Let me know. And don't forget to like and subscribe for more stories of ultimate calculated revenge.